This is Kim Newlove, host of the Pharmacist Voice podcast. Thank you for joining me for episode 87. If you're new to the show, welcome. I alternate solo shows and interview shows. The solo shows are about my career change from pharmacist to voice actor, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. My website is thepharmacistvoice.com. Today's episode is an interview with Angel Bivens. Angel is a pharmacist by training. She has experience in retail, hospital, home infusion, and mail-order pharmacy. But her true passion is working at the Maryland Poison Center, MPC. The Maryland Poison Center is part of the Department of Pharmacy Practice and Science at the University of Maryland School of Pharmacy. Angel has been with the Maryland Poison Center for over 25 years. She spent the first 8 years as a specialist in poison information, managing poisoning and overdose cases from the public and healthcare professionals. Then she spent the next 17 years in the role of public education coordinator, ensuring that more than 4 million Marylanders in the MPC service area know about their services and learn ways to keep their families safe from poison dangers in and around their home. Now an assistant director, Angel oversees operations and public education. When she started this role in 2018, she combined her love for educating the public with responsibilities that ensure there is always someone there to help with a poisoning or overdose 24/7, 365. Angel completed her BS in pharmacy at Duquesne University in Pittsburgh, Pennsylvania, and her MBA at University of Baltimore in Baltimore, Maryland. She also holds the designation of Certified Specialist in Poison Information, or CSPI, after successfully completing the American Association of Poison Control Centers certification examination in 1990, 1998, 2005, 2012, and 2019. Just a quick announcement for parents listening to this who may have children in the car. Some of the topics in this episode include children putting weird things in their mouths and poisonings. Listener discretion is advised. Now, without further ado, here's my conversation with Angel Bivens. Hi, Angel. Welcome to the Pharmacist Voice podcast. How are you?
I'm great. How are you, Kim?
I'm good. We are going to be talking about poisoning prevention, poison centers, and much more.
Excellent.
Angel, can you tell me how you use your voice at the Poison Center?
Well, I've been at the Maryland Poison Center for a number of years, and through that time, I've actually worn many hats. So in wearing my Poison Center specialist hat, I manage poisonings and overdoses as they come in on the emergency lines. So that's the way that I use my voice in that capacity. As a Poison Center educator, I was responsible for all public education and outreach, including creation of educational materials, poison education programs, media interviews. So again, another powerful way to use my voice in the Poison Center. And finally, as assistant director, I still oversee all of the education efforts and try to increase visibility of poison centers through partnerships in the community.
That's great. So many different hats. It sounds like you presented them in chronological order. Would that be correct?
That would be correct. Yes. I started off my career more than 20 years ago as a pharmacist answering the emergency lines, and then progressed to the public education coordinator, and finally now am the assistant director.
Great. Well, it's wonderful. We're going to be able to hear about all of those different hats and learn from your experience. I've got to ask, though, how did you get started in the Poison Center?
Believe it or not, I discovered my love for toxicology all the way back in pharmacy school. While I was in school, I took the toxicology elective and just loved that. And even tried to pursue a master's in toxicology during pharmacy school, do that combined BS pharmacy, master's in toxicology. My GPA didn't quite let that happen. So I had to regroup and figure out another way to find my passion in toxicology. I tried to do a rotation at the poison center near where I went to school, but that wasn't available to me either. Okay, so 2 strikes, but that wasn't going to deter me. So, though finally I graduated from school, started working in retail, and a friend was working in a pharmacy, and one of her coworkers was leaving her position at the Maryland Poison Center, told me about it, and I immediately applied, and the rest is history. I jumped on that opportunity, and I took some time away to try to find some other to see if I was truly meant to be at the Poison Center. But I quickly realized that I wanted to come back, and I've been back for more than 20 years currently.
Well, congratulations on all that time at one place. Not everybody does that anymore.
It is quite odd, but when you find your passion, it doesn't seem like you're working.
I've heard that before. That is wonderful. Now, just as a little bit of a follow-up question, it sounded like when you applied to the Poison Center, you got the job right away. Is that right?
It is. It is. And it's very interesting. It's we refer to it in the Poison Center as rescuing retail pharmacists, right? Because it's another avenue that you can, it's a non-traditional role of a pharmacist, but it gets you away from being on your feet and fighting with insurance companies and, working with no technicians, et cetera. It just gives you another avenue to go ahead and use your clinical skills, your people skills. And so it's great work if you can get it.
Awesome. I did consider working at a poison control center once, but I didn't pursue that opportunity. Next, I want to ask, since you said that back in the day, more than 20 years ago, you got that job right away. For anybody looking to become a poison center pharmacist now, what kind of education and training is needed? And would somebody be likely to get that job right away, or would there be a lot of competition?
Well, there are only 55 poison centers in the country. So you already have a limited employer pool, if you will. But some poison centers hire pharmacists and nurses and physicians. There are other poison centers that are nurses only. So it really depends on the particular poison center that you're in your area, if you want to stay where you are. But you would have to, try to match your skills with the poison center and their requirements. But like I said, pharmacists, nurses, physicians staff most poison centers. So it's just a matter of finding a poison center, reaching out, and figuring out what their hiring process is.
Okay. Well, it sounds like not all poison centers need pharmacists. So that's problem number one.
Yes.
But if somebody were to apply, would it be a pharmacist as in BS Pharm, or would they take PharmDs? Is there additional training on top of that? You mentioned you considered a master's degree in toxicology. What kind of education level is required?
For the most part, right now, most job descriptions for pharmacists in poison centers will be written as PharmD required. Not sure what the grandfather clause would be for a BS pharmacist with experience. So that's going to be poison center to poison center dependent and HR dependent. But you don't need any additional board certifications or degrees or anything like that. Just your regular PharmD or BS pharmacist with experience should be enough to get you in. But usually when those openings happen, they're pretty competitive.
I've heard that there's a lot of jobs that pharmacists apply for these days, and there's a lot of competition. There's definitely more than one applicant.
That is true. That is very true. So whereas it might not be a requirement to have a residency or something like that, or to work in a hospital, that might be the competition that a retail pharmacist is facing. At Maryland, at our poison center, our past couple of pharmacist hires have been retail pharmacists, and they've done great. So it's not to say that it can't happen, but it depends on the pool of applicants out there for an opening.
And once you hire a pharmacist, whether they're from a retail background or a hospital background or so on, what kind of additional training is required once they get into the poison center?
There's a lot of training that goes into being hired as a poison specialist. It is not anything like being hired at a hospital or being hired in a retail store where you get a couple of days of orientation and then boom, you're left on your own because you're a pharmacist, right? We bring our people in and we train them. It's not like any other training you've ever experienced. So a lot of it is reading, listening to calls, preparing for one-on-one presentations with a toxicologist that you, as the new poison center specialist, have to prepare a topic. And we have a list of like 30 odd topics that you have to be in tune with. So you'll have to know your calcium channel blockers inside and out. You'll have to know your household products inside and out. Chemicals and things like that. So it's a lot of preparation and intensive training. For our training, it's a good 3 months before you are really ready to take shifts really unsupervised. Okay. And even then, you're not working alone. You're still a member of a team. And it might be another couple of months before you are alone and the only one answering calls. So it's a lot of training in-house. Once you successfully get your training and manage 2,500 or more human exposure calls, you are then required to sit for a certification exam. Okay. Once you successfully pass that, you become a certified specialist in poison information, or as we call them, CSPI.
I've heard that term before when I interviewed Dr. Wendy Stefan from the Florida Poison Information Center in Miami. Yes, I think that's a cool term. I grew up with James Bond, and it makes you guys sound like you're poison spies. That's cool.
It's awesome. And it's much better than what we used to be referred to, poison information specialist. And we'll leave it at that.
Okay. Well, it's such a comfort to know that if I need to call a poison information center or a poison control hotline, there are people who are equipped to handle those calls. That's awesome. I need to hear that. That's great.
Yeah, that's one of the big misnomers out there, is that it's just a volunteer or an untrained person that answers calls at a poison center. And it couldn't be further from the truth. You have highly qualified, very specially trained, certified people managing the calls that come into the poison centers. And that's in all 55 poison centers in the country.
You talked about a lot of the training that's required. Even though you're highly trained, what are some of the resources you use most often?
Well, the main resource that we use is our experience. If you think about it, a poison specialist manages anywhere from 2,000 to 5,500 cases per year.
Wow.
Multiply that by the number of years of service, and you have a quite extensive knowledge base that you've developed. And then you package that with your coworkers who are doing the same thing. So we really do rely a lot on the training, but then our personal experience and how we've mentioned or managed other cases that we've dealt with in the past. But outside resources, we rely heavily on Poisindex, which is part of that Micromedics online package that many are familiar with. We have some go-to textbooks, Goldfrank's Toxicologic Emergencies and Lang, Poisoning and Drug Overdoses are go-tos right from the get-go. We have access to a health services library on our campus. So we have all of those journals that we can look up. And then we have actual consultants. We have medical and clinical toxicologists that are on call 24/7. So if we can't find it in our own experience, if we can't find it in a book or in a journal article, we always have somebody who's a phone call away.
Wow. Just wow. You guys are very prepared. That's amazing.
We realize that we have to be, right? Because we equate being a poison center pharmacist with being a specialist in a hospital. So if a patient comes into an emergency department and they have chest pain, they're going to call a cardiologist. If they come in and are having stroke symptoms, they're going to call a neurologist. Well, if you come in with a poisoning or overdose, you should call a toxicologist, but there are not very many licensed, certified, credentialed medical toxicologists, so that there is one at every hospital. So we are that toxicologist consult by phone.
I get it. Wow. That's great. I want you to put on one of your 3 hats that you've worn at the Poison Center and tell me about a time you assisted with a poisoning, either accidental or intentional, or an overdose, or both.
I've had a very long career at the Poison Center, but I can honestly say that the time that rings loudest to me was early on in my career. It was probably one of the first couple of years that I was a poison specialist, and it was still very memorable for me. I had a teenage girl call, told me she took a large amount of aspirin. When we take a history, especially from someone that's trying to hurt themselves, sometimes they underreport what they did, sometimes they exaggerate what we did. So we have to really take what they're saying with a grain of salt. Sometimes, it's basically a situation of, what is happening with her and what is going on. So we ask a lot of questions, find out that she was upset because she had a fight with mom. She wasn't happy with school, typical teenage stressors. And in talking with her, I quickly realized, she really just needed somebody to talk to. Phones weren't really busy. I was able to afford the time to really talk with her and see what was going on. But in the course of that, remember, she said she took a large amount of aspirin. In the course of the conversation, and I was on the phone with her for quite a time, she started complaining of ringing in her ears. She started to complain that she was sweating. And immediately I'm like, oh my goodness, she really did this. This is not just a cry for help. She really did this. Now, from the get-go, when she told me what she did, I did recommend that she seek treatment in an emergency room. She resisted. She stayed on the phone, talked to me, and I talked through a lot of things with her. But when she started having those hallmark salicylate poisoning symptoms, I was like, no, we have to do something. Asked a coworker to get a trace on the line, because this was well before caller ID. Got a trace on the line. We were able to send ambulance to her and got her to the hospital, and she did quite well.
Oh, good. Wow. Well, thank you for the important work you did there. That's so helpful, and you saved her life.
And it's amazing how that sticks with you. And that's one of the best parts of this job, is that you realize that you are truly helping people in the moment.
Definitely. Yes. That was quite a story.
It was probably the freakiest thing I've ever experienced in the 20 plus years, to have that be the thing that comes to mind.
That's scary. And, as a mom, I think about, God forbid, one of my kids or their friends has a problem. I would hope there's somebody like you out there
Yeah.
to field that call and give the right advice. Next, Angel, I want to ask you, how do callers get a hold of you? I know that there are individuals with poison emergencies that contact you, but how about nurses, nursing homes, hospitals, schools?
The best way to contact the Poison Center is still using our nationwide 800 number. It's 1-800-222-1222. That phone number is shared by all 55 poison centers. Okay, now it's supposed to be a smart number, right? That when you call, it knows where you're calling from and it sends you to the local poison center that you are near. And it usually works, but sometimes it doesn't, and it depends on the cell phone carrier and things like that. So all poison centers manage all calls that come in. If it's a situation where we can manage the call at home, we do. And most of the time, we don't even realize that it's an out-of-state caller that's calling us. If it's something that needs to be managed in a healthcare facility and we realize that it's out of state, again, we still manage the call. We make the recommendation to go to the healthcare facility. We find out where they're going, send them on their way, and then we at our poison center pick up the phone and call the poison center that manages the healthcare facility where they're going, and we transfer the case to them. And so it all happens seamlessly. So when you call that 800 number, you're not calling a national hotline. It's not like the phone goes into one place and then you never know who you're going to get. We try to get it to the local poison center assigned to your area. But healthcare professionals and first responders and the public all share the use of that same 800 number. Even folks on military bases outside of the country, if they have or if you're vacationing outside of the country, if you're using a U.S. cell phone, you can go ahead and use that 1-800-222-1222 number and get connected to a poison center.
Very good. Would that be the same number that nurses, doctors, emergency rooms, schools, all those people use the same number?
Absolutely. We feel that it's just easier to promote one number, and all poison center specialists triage the calls that come in. So you can imagine when you're sitting there, you might have more than one call, and we do triage and know if it's a small child that swallowed a glow stick, we might have to put them on hold because we have a nurse or a doctor on the line with a multi-drug overdose. But we manage both at the same time, efficiently and effectively, and in the best possible way.
I love the teamwork. That's awesome.
It's necessary, right? In order to go ahead, because you can't dictate how quickly the calls come in or when they come in. You have to take the calls as they are and know what can wait and what can't. And we explain it in the most professional way as possible. For instance, if somebody would call about a child who got into something that was not harmful and we knew we had another call coming in, we wouldn't put them aside. We would say, you know what? Your child is going to be just fine. I want to talk to you in detail about this, but hang on one second. I have a hospital calling me. I will be right back to answer all of your questions about your situation, but your little one is going to be just fine. So it's not like we just put them on hold and have them worry while they're on hold. We allay their fears, tell them we'll be right back, and then go manage the hospital.
I didn't realize how much triaging you do. And you mentioned that some days are busier than others. That is very interesting. I've got to ask, is there one day on the calendar that's busier than another?
I wouldn't say busier, but type of calls, yes. So we call 4th of July and Halloween are glow stick days. Okay, get a lot of calls about glow sticks on 4th of July and on Halloween. And I would say that it's not a particular day, but at our center, at least, our evenings are busier than the other two. So it's a time of day. So evening shift tends to be busier than day shift. Weekend mornings tend to be a little lighter than a little later in the morning or the rest of the day because, everybody's sleeping in. So it's more of a time of day than a day of the year.
All right. Well, and thank you for that warning about the glow sticks. I hadn't thought of that. I have a son with a disability and he has, I believe they call it pica, where he eats non-food items. I'll have to watch out for that. He hasn't eaten one yet.
Well,
but
the good news is
watch out.
They're harmless if they're ingested. More trouble if you get the stuff in the eye. It's very irritating. And it tastes really bad, but in general, it's not a terrible ingestion. So they're easy calls. It's just the volume. It's not that they're a problem. It's just the number of calls that make it a busier day.
Thanks for pointing that out. I was curious if that was going to be a poisoning issue or if it's just more, scaring parents.
Yeah.
Sounds like, it's
scaring
fairly
parents,
harmless.
but we still prefer people to call because you don't know that somebody might have an underlying medical condition or something like that. So it's still best to call. But again, we waylay those fears right away.
Awesome. Whew. Again, thank you for the work you do. That's great. Okay, you and I just talked about how parents contact you about glow sticks, among other things. Who actually calls you, though? Is it always parents? Is it more often about kids? I mean, who contacts you about what kinds of things?
Well, poison centers across the country get calls from everyone. We get calls from the public, from healthcare professionals, from fire folks, from EMS, from the police. So we get calls from everybody. Calls from the public, they might be from parents with kids of all ages. Okay, so we gave the example of the little kids biting into a glow stick, but we have parents of tweens that are doing those crazy challenges on TikTok that we get calls about.
Oh,
We get calls
hmm.
from parents of teenagers who are trying to hurt themselves or who might have substance abuse issues. We get calls from adults. They could be about themselves, about their kids, about their parents, about a friend. And we get calls from older adults. And that could be about themselves, about their spouse, about their adult children, about their grandchildren. So we get calls about from the public on all levels. We get calls from healthcare providers, maybe from a primary care practice or a pediatrician's office. Emergency departments call us, critical care units call us. Callers could be doctors, nurses, pharmacists, physician's assistants, nurse practitioners, or even paramedics out in the field actually managing an emergency.
Well, that's a long enough list. There's a lot of people that call for a variety of reasons. That's interesting. Now, you mentioned pharmacists might even call. When I worked community practice, I called when somebody needed a pill identified because I didn't want to be responsible for giving out that information. Can you explain maybe a couple of reasons that a pharmacist would call a poison center?
Sure. Well, we know that pharmacists are still one of the most respected professions. And so oftentimes people will think, I'm going to call the pharmacist for a question. And many times they are equipped to answer those questions, but sometimes they're not sure. In your instance, you didn't want to do the drug ID, but maybe a drug-drug interaction, maybe a drug supplement interaction that you just don't have the resources right at your fingertips. Or a non-medicine ingestion or exposure. Pharmacists will call us and say, what should I do? That's at a retail level. At a hospital level, if pharmacists are mixing up an antidote or N-acetylcysteine for an acetaminophen overdose or a treatment, and sometimes they just have questions about how things are run. One of the latest greatest things in treating poisoned patients are using intralipids. The stuff that you put in a TPN is actually being used as in to treat tox patients. So we'll get calls about how to do that. So it creates like a lipid sink. So it circulates through the blood and pulls out those lipophilic drug particles.
Oh, okay, I gotcha.
So yeah, but so pharmacists can need to call the poison center for any number of reasons, and we're happy to help.
As the person that answers these calls, what's it like to help someone?
You know what? I have to say that's probably one of the best parts of working in a poison center is knowing that you are truly helping someone. You can actually hear it in their voice when you're talking to them. Whenever a parent, especially, calls about their child or anybody calls about a loved one and they're concerned about something that they've been exposed to or that they've taken, they are very stressed. You can hear that in their voice. And just in talking to them, you can hear that stress level come down. And it is very rewarding knowing that you are, in fact, helping someone right there with a situation that they're stressed about that they don't need to be stressed about. And even if it is a serious situation, we can give them the information they know or that they need to help them deal with it psychologically. So we might be sending their loved one to the hospital, but we can tell them what to expect and how things should play out. And that, again, just calms them and makes them feel so much better. And so it's a very rewarding feeling knowing that you're helping people right away.
Thank you for sharing what it felt like to help someone. I'm sure that's very rewarding and it makes you want to do your job even more, right?
It does. It does. Again, if you're doing something you love, it doesn't seem like work. And when you can have that sense of helping someone, that sometimes is the driver for many people. And I think that that's an important part of my career is I like helping people. And so I think I found that the best possible place for me to work.
It must have been hard to change hats then. You go from answering the calls to doing something else. How did you make that change? How did you know it was time to make that change?
Interesting story. So I was on the phones and loved doing the phones, but then my son was 4.5 years old and said, "Mom, I want you to be home when I'm home, and I want you to work when I'm at school."
Oh,
Well, good luck with that because the Poison Center is 24/7. I work weekends, I work nights, I work weekends, I work holidays. As a poison specialist, how do you do that? The educator role was open. I pitched the idea to the director. Hey, what would you think about me stepping into the educator role? Previously, we had teachers or nurses do that. So I said, what do you think? And he said, well, we could probably make this work because you have an MBA, so we could make it a marketing position. So, in addition to educating with all of your experience as a specialist, you have marketing and communication skills that we could go ahead and use. So, that's how it worked out that I transitioned. And it's still, I found myself still feeling like I'm helping people because instead of helping them in the moment in a poison emergency, I'm helping prevent a bad thing from happening. So educating them is still indirectly helping them.
wow, that's a cool story. And then you were able to be home for your son, right?
Yes, because as a poison center, so as a poison center specialist, a spy, you're working all the different shifts, like I said. As an educator, you're typically Monday through Friday, some evenings, some weekends, but you're pretty much setting your own schedule. And as assistant director, I'm still Monday through Friday, but more on call. But I still keep my hand in the public education arm of it as much as I can, just because that's my one of my favorite jobs is reaching out and creating things and educating people not only about how to be poison safe, but who we are and what we do and why you should call a poison center.
In your role that you have right now, do you get to hear all of the stories about all the calls that are coming in? Do you have some sort of a connection to the people that are taking the calls at the call center?
It's better when we're not in a pandemic because, yes, I would walk out into the center and talk to the specialists. We have been completely remote since March 14th of 2020. So the way that I stay in tune with the specialists is one of our missions at the Poison Center is to also educate. So we educate healthcare providers. We have pharmacy students that do rotations at the Poison Center. We have medical students that come in and have rotations. We have pharmacy residents that come in. We have paramedic students. And so we quickly were able, prior to the pandemic, we would bring everybody into a conference type situation once a day. We would go over all of our more sick patients, if you will. So the folks that are admitted to hospitals, and we would just dive into their case and do case conference. We quickly had to spin that off and do that remotely as well. And that has been one of the blessings of the pandemic is that we have now a very robust educational program. And so I can sit in on rounds listening to the toxicologist talk about our cases or talk about a tox topic. And that's how I hear about the cases and stay in tune with the poison specialist. So I know what is happening on the phones. We use Teams to communicate with one another. So I see snippets of cases that are coming in, usually just the oddball ones, not the run of the mill stuff. And then I do kind of look at cases in the database just to see what's happening.
Since you mentioned oddball cases, this is a great time for me to ask, what's one of the most unusual poisonings you've come across or heard about?
Hands down, the most unusual call that I have taken as a poison specialist was about a goat. A
Okay.
woman called me because she was concerned that her goat ate something that she didn't think the goat should have eaten. I was very confused because aren't goats supposed to eat everything? Isn't that why they were put on this earth, is to just kind of be that goat garbage disposal? I kind of made the mistake of saying that to her. She wasn't happy. She was like, no, I'm very worried about my goat. And I'm like, okay, let me put you on hold and see if I can find some information. A lot of times our databases do have information about animals. We are primarily a people poison center. We're pharmacists and nurses, not veterinarians. But if we can help with pets, we will. So I look up the information. I quickly see that there is animal information. I went ahead and was very excited. I click on animal poisonings, and then I have to decide, is it a canine, a feline, a lagomorph, a rodent? And I'm like, what's a goat? I have no idea. A goat is a mammal. What is a goat? Couldn't figure it out. Didn't want to keep her on hold any longer. So I went ahead and told her I couldn't find any information to answer her question, but I gave her 2 phone numbers for animal poison centers. There are 2 animal poison centers in the country. Gave her both resources, told her that they were both wonderful resources, and I'm sure that they would be happy to help her with her goat. So she seemed to be happy at the end of the call. But again, most unusual, hands down.
Oh my gosh. I would not have expected that to involve an animal, but hey, this is great because you told me that there's animal poison control centers. Who knew? I really didn't know that. And
Right?
I've done plenty of volunteering with poisoning prevention in my day. So thank you for sharing that.
Not a
And that
problem.
also that also reminds me of the book Gregory the Terrible Eater. Have you ever read that book? It's a children's book.
I don't remember that one when my kids were little.
Well, when my kids were little, I have an almost 18-year-old, I can't believe it. There was a book that was part of the Reading Rainbow series, if you remember them from TV. I think LeVar Burton used to get on TV and read these books, and Gregory the Terrible Eater was one of them, and it was about a goat, and he didn't want to eat the junk. He wanted to eat peas and carrots and bananas and good food, but his parents wanted him to eat tin cans and other things. And I was just thinking of that as you were telling that story. So that was one goat that didn't want to eat the junk.
There you go. And clearly this woman didn't think that her goat should have eaten, and I don't even remember the specific substance, but she knew enough about the goat that she thought that that could be a problem.
All right. Well, I'm glad she got at least a referral
Yes.
to get the help that she needed.
Yeah.
And that's important. Yes. We've talked about some of the happier things, like what does it feel like to help somebody? But now I'd like to ask, what's one of the biggest challenges you face in your role or one of the other roles that you've had at the Poison Center?
Well, as a poison specialist, probably the biggest challenge is managing those oddball cases, right? Things that there's just not a whole lot of literature, things that are new. Um, those are the most challenging cases, and those are probably the most stressful cases or calls for me. It's okay though, because we can get the consult with our clinical or medical toxicologist. It still becomes a challenge though, because that's time consuming and the phones don't stop ringing. So then you still have to balance. So that's probably the biggest challenge of a poison specialist, is managing the odd cases, but also the volume. Sometimes the volume is overwhelming. As a poison center educator, the biggest challenge is reaching the public. First of all, there's a new parent created every time a new baby is born, right? So we're constantly having to reach out to new parents. And it's not like it's a one size fits all. So trying to figure out how to reach all of the different people in your service area is quite a challenge for an educator. And then as an assistant director, the biggest challenge is staffing the phone lines, making sure there are bodies to answer the calls. We have a great staff, and in general, they are so dedicated that, aside from asking for their vacation that is definitely earned, they just don't call out very often. But sometimes life gets in the way and they do need to call out. So then I'm in scramble mode. And it's not like you're at a pharmacy or in a hospital where you can call a staff pharmacist in to fill a hole, right? You can't get a rent-a-pharmacist. We have to staff all of those holes with our own people because of the highly specialized training that we all go through.
Those do sound like challenges. And I think you guys must do a beautiful job of managing it, because every time I've ever called the Poison Center line, somebody answers the phone. Now, you're in a different state. You're in Maryland. I'm in Ohio. And usually somebody from, I believe, Columbus or Cincinnati. Would that be right? They pick up?
That would be right. Yes.
Yep. And like I said, I have a son with a developmental disability. He has autism, and he's put a number of things in his mouth, like leaves and things of that nature. And I just want to make sure he's going to be all right. And somebody always answers the line. So yeah, it sounds like you tackle your challenges. You take them as they come.
And I love the fact that you call whenever he puts something in his mouth. So many young parents, and this is another challenge, is getting folks to call. People don't want to call a phone number anymore. What do they want to do? They want to look
Google
stuff up online. They want to search with their thumbs. Yes, we call it the Dr. Google effect. And that's a huge challenge for poison centers across the country. And that's in any role that I'm in, is how do we get people to pick up the phone and call rather than Google? So I'd like to take this opportunity to tell your listeners how they can promote calling rather than Googling, if that's okay.
Go for it.
We want people to call because they're going to get the right answer right away. If you Google something, what happens? You get a list of search results. And then you have to sort through those search results and figure out which ones are real, which ones have legitimate information, which ones don't have legitimate information. And lo and behold, what happens if they have conflicting information? All of that takes time. Instead, if you pick up the phone and call, you're going to get the right answer right away, usually within a minute or two, outside 3 minutes to manage a call from the public. Okay, so we encourage people, call, don't type. We want people to go ahead and call a poison specialist, get your answer right away. You know it's the right answer.
Yeah, good point. And you do follow-up calls, right?
We do follow-up calls. So it's not a one and done. It's not like we leave you, kind of on your own. We will manage the situation. We will make recommendations. We will tell you what to look for. And so if something different happens than what we tell you to look for, we encourage you to call back. And if we don't anticipate that there's going to be symptoms, we won't do a follow-up. But if the person is symptomatic at the time of call, or if we expect something to happen, we will do a follow-up call at home to make sure everything's okay. We follow up all of our hospital calls till they are discharged or admitted to a psych facility, or until they die. So we follow up to make sure that the patient is managing or being managed and progressing the way we think. And then we can also change course and recommend different treatments if need be, if we realize that they might not have been exposed to what we think that they were exposed to.
I wonder if some callers are afraid that there's going to be some sort of repercussions, like child services is going to be called or something like that. Can you just reassure people, that anybody that might be listening, that that's not the goal? We're trying to save a life, or, poison centers are not trying to punish people.
That is correct. Obviously, I would really only know the inner workings and the policies and procedures at our poison center. But in general, that is the case. We are there to help, and we are not a reporting agency, although we do keep children's and other people's interests at heart. We don't necessarily make those referrals to social services. We have other ways of making that happen if we think there is a situation that needs tending to. Most poison centers, though, will proactively report cases of suspected food poisoning if it's a public eatery. So we will do that. But if you get food poisoning from grandma's, Thanksgiving dinner, we're not reporting grandma to the health department. Okay. We'll just help everybody manage their symptoms. But, any cases of potential food poisoning at a public eating establishment, that is a reportable situation for us. And with regard to child abuse or neglect, we have ways around that. We wouldn't call directly. We would refer the person into the emergency department so that they can actually investigate the situation.
That is stressful to even think about. But, if somebody's being poisoned, and they're also worried, is somebody going to call Child Protective Services? I can only imagine if a parent is having that conflicting thing, trying to save a life, but also they don't want to get in trouble. I'll tell you, I have a kid with a disability. No Child Protective Services has ever come to me and called me out on being a bad parent or something. I can't help that he eats leaves, or rock salt is another thing. I didn't know what to do about that when he started eating that. And if anybody's listening to this with kids in the car, just, be advised, you might want to talk to your kids about this, but it's not normal for kids to do that. I don't want to worry anybody, but at the same time, poison centers are there for people like me and my son, and to help and not to punish.
And they're there for people like us. I can honestly say that most of us at the Poison Center that are parents have had to write up their own kid as a poison exposure. My daughter got into something, okay? Back in the day, one of our longtime employees actually had to use syrup of Ipecac on her son because he got into ibuprofen and she just didn't know how much he got. So it definitely, for a parent to call the Poison Center, in no way, shape, or form is reflective of your parenting. It's just things happen and we are there to help you. So it can happen to anybody.
Well, let's turn this conversation to a happier topic, shall we? What's one of the best things about working in poisoning prevention?
Like I mentioned, the best thing about the job is helping people. But the second best, and it's pretty close to the top, is that it's always different. It's that unknown. You don't know what's going to be on the other end of the phone. It could be a glow stick. It could be a multi-drug overdose. It could be a brand new substance of abuse that you have never heard about, and you have to go ahead and research. So it's that kind of unknown. It's kind of an adventure. And the fact that even no two Tylenol overdoses are going to be the same because no two people are the same. So it's always different. We don't get bored. I can guarantee you that boredom is not one word that you would have a poison center specialist say as far as something that they don't like about their job. There's no way that they're bored because it's always something new, something different. And there's always new things coming out. There's new medicines that we have to learn about. There's new substances of abuse that we have to be up on. There's new TikTok videos that we have to stay ahead of. So there's always something that we have to learn. So those are the two best things about working at the Poison Center.
Thank you for sharing that. And I got to ask about the TikTok videos. Do you have somebody that reports these TikTok videos to you, or are you getting phone calls about poisonings and people are mentioning TikTok? I mean, how do you even find out about that?
A lot of times it's just staff members knowing that their kids are on TikTok and they'll mention something. One of our public educator, that's her thing. She's on social media a lot, right? Because we have a social media presence. So we learn about that. We hear from school nurses, right, about things. So it's just a whole host of ways that we hear about them. And sometimes the news, the Benadryl challenge, I think, came to us in the news. I can honestly say that I don't think that we had any calls about the Benadryl challenge maybe we did, but not many, or the Tide Pod challenge. That was another, famous one out there. So we just keep our ears open and, deal with them as we need to. whenever we hear about them. We try not to proactively draw attention to these things because we don't want to make them seem like a big deal. But we will comment on them professionally if we need to.
Wow. And that's where you put on your educator hat, or somebody in your department puts on the educator hat and gets out there and spreads messages so the parents can become aware of whatever's being out there on TikTok and other social media platforms.
Absolutely.
Wow. Certainly never a dull moment. You're right.
There is not a dull moment. Never, ever, ever.
Angel, what's something people don't realize about working at a poison center?
Probably the fact that it's pharmacists and nurses that answer the calls. I can honestly say that certainly from the public's point of view, but I think there are some healthcare professionals that didn't realize that it's pharmacists and nurses that are primarily the people that are answering the calls. And beyond that, the fact that we don't work off of scripts. Okay, we don't have a flow chart. You call us and we are not reading off of a script. We're not reading off of a flow chart. We are managing the case on its merits. We ask questions in different orders, and we're just, somebody might say something and that takes us down another avenue of questioning, et cetera. So every case is managed individually, not scripted, and it's by a pharmacist or a nurse. That's probably the biggest misnomer out there, is that it's just volunteers answering the phones.
Interesting. I wouldn't have thought that you did have a script. So I'm kind of surprised that anybody would think that. No judgment. It's just interesting to hear kind of myths about what you do.
Right.
What's a typical week like for you? I think we already talked about when you were a poison information pharmacist. When you first started off, you were more like first shift, second shift, third shift, could be anything, weekends, holidays, evenings, everything. Is that right? And then just go ahead and tell me about the 3 different hats you wore and what your schedules were like.
Yeah, the as a poison specialist, you're pretty much just rotating through all of the different shifts. Now, different poison centers will staff their phones differently, right? So I can again just speak to how we do it here at the Maryland Poison Center. When I first started, we were on 8-hour shifts. And so there would be like a 7 to 3 and a 10 to 6 and a 3 to 11, typical shifts. And if you work the weekend, then you got a day off during the week. We now do 12-hour shifts.
Wow.
And so our folks work, we have 2 teams. They aren't solely on a team, they can cross over, but typically we'll have one team on Monday, Tuesday, Friday, Saturday, Sunday, and then they're off and then work Wednesday, Thursday. And then the other team is opposite of that. And so it's 12-hour shifts during the week and it's 10-hour shifts on the weekends. We are lucky enough, our staffing has 2 night shift people. They work 7 on, 7 off from 9:30 in the morning or at night until 7:30 in the morning. But when they get time off or if they're sick, our non-night shift people have to fill in on nights. And of course, we do have to staff holidays. So we, again, try to be as family friendly as possible and limit that. So we work 1 summer holiday, 1 winter holiday in general. Okay. Again, in an ideal world, but sometimes stuff happens and you have to cover. So that's how it happens for poison specialists. They're working all different shifts. Again, the educator, Monday through Friday, typically, sometimes evening programs, sometimes weekend programs. And then the assistant director, it's pretty much administrative hours, but on call should something be needed.
This podcast episode's coming out in March of 2021. Why is the month of March important for poisoning prevention?
Well, there are some centers that call it Poison Prevention Month, but it's actually Poison Prevention Week is the 3rd full week in March. This year, it happens to fall on March 21st through the 27th. And that's just the time that we raise awareness of poisonings, overdoses, and services of poison centers. That's been around since 1961, when President Kennedy signed it into law that we would recognize the third full week of March as Poison Prevention Week. And that was needed because back then, little kids were dying from poisonings and overdoses. So that was the way of raising awareness. So you have that. That wasn't enough. And then in the 70s, you had the Poison Prevention Packaging Act that was signed into law that required those child-resistant containers. So again, most of your pharmacists will remember these two things from pharmacy law in their pharmacy programs. And we live it. We actually do experience both hands-on with the National Poison Prevention Week and the Poison Prevention Packaging Act. So we do draw attention to it. But we like to remind people that that's not the only time that you need to be aware of poisonings and overdoses. So it's great to have that extra oomph in March, but every day is Poison Prevention Day.
With your line of work, definitely. Now, how could pharmacists get involved with poisoning prevention?
My best suggestion would be to reach out to your local poison center. And you can find that information at the American Association of Poison Control Centers website, www.aapcc.org. They actually have a link, I believe, on the homepage to find your local poison center. So that's where I would start. I would recommend that pharmacists reach out to their local poison center and find out how. Ask for the educator. All poison centers have an educator. So contact the poison center, ask for the educator. You can even call the 800 number. Hopefully you'll get your local poison center. You don't have an out-of-state phone. But if you get to the wrong poison center, we'll get you connected. But reach out to the educator, find out what they're recommending. If you're a retail pharmacist, try to get some materials that you can go ahead and make available to your customers during that week. If you're a hospital pharmacist, maybe try to set up a table display. So again, try to go ahead and get some materials that you can hand out, things that have our phone number, promote our services to the folks at the hospital, the patients, et cetera. And some poison center educators are looking for volunteers to help do some educational programs in their area. Again, that is all very poison center specific. So you need to work with your local poison center if you want to get active in poison prevention.
Thank you for all those tips. That's great. I like how you were talking about getting materials with the phone number on it. Isn't that one of the items that you recommended?
It is. You would go to your local poison center and figure out how you would obtain materials from them. Again, poison centers are local. We have a pocket of money provided by our states. So we can't ship stuff over state lines. We have to stay within our service area. So we do recommend that you work with your local poison center to get stickers, magnets, brochures. Some poison centers are going to all downloadable stuff. So you might find a website where you can get downloadable information and go ahead and do that. But it's great if you can go ahead and promote the phone number and promote calling the poison center with questions about poisonings and overdoses.
Great. Yes, that phone number again?
1-800-222-1222.
Great information. This has been a very informational and interesting interview. Thank you so much for being with me today. Is there anything you'd like to share before we wrap this up?
No, I really appreciate the opportunity to go ahead and share the world of poison centers with your audience. It's a non-traditional role that a pharmacist can play. And so if you're looking for a change, reach out. Like I said, there's a finite number of employers, but we're always looking for new people. And if not, if you could just recommend our services, because we truly are experts and are very good at what we do, and we are there to help.
Excellent parting comments. Thank you again so much for being with me today on the Pharmacist Voice podcast. I hope you have a great weekend.
Thanks, you too.
Thank you for joining me for episode 87 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to subscribe and read the show notes.